evening, everybody. I'm Julia Landau from Mass Advocates for Children, and I'm joined from my office by Lilia Malikshi, who's our communications manager, and Joanne Pino. And we are really thrilled that tonight we're going to hear from Dr. Borrero, who is the psychologist from Boston Public Schools, the director of behavioral health services. We know that you've been dealing with an overwhelming amount of uncertainty over these last 6 months and certainly over these last weeks, as you've all been waiting to learn specifically how and when is your school district going to reopen, when, if at all, will your child be offered in-person learning, what is the safest choice for your child and family, and how is your child's IEP going to be implemented, whether it's full-time, remote, most of the time in person, or a combination of a hybrid of remote and in person. And we all know that they have experienced, I'm sure many of you, that the pandemic's had a huge impact on the social and mental health needs of students with disabilities. Students have been experiencing the illness of their family members and friends. Many have experienced the stress related to the pandemic of job loss and housing and food insecurity, and then coupled with the huge impact of the lack of school supports and services. And then we know that every aspect of the coronavirus pandemic is disproportionately impacting people of color and the Black and Latinx children and families in our schools. And then on top of that, the Black families are further coping with the stress and trauma of the escalating racist violence and police brutality that is impacting everybody across our country. So it could not be a better time to have Dr. Ivonne Borrero here tonight to help us talk about tips and strategies for how families and school districts can address the very challenging for many social and emotional needs of children and youth with disabilities during these unprecedented and challenging times. This will be 45 minutes, and Dr. Borrero will stay for those who want to until 9 o'clock for more questions. And Lilia is going to briefly go over some logistics before we turn it over to Dr. Borrero. And there's a first polling question just to ask what kind of disability your child has.
Hi everyone, thank you for joining us tonight and welcome back to all of our regulars. We'll be pausing throughout the presentation tonight to take your questions. So please submit your questions at any time using the Q&A button on the bottom of your screen. Those of you joining us on Facebook, please submit your question as a comment under the live stream. Our volunteer, Christina Perez, is there to facilitate your Facebook questions. If you see someone else's question that you'd like us to answer, please give it a like. And also, please keep an eye on the chat box if you're on Zoom and in the comment section for Facebook for resources that we'll be sharing throughout the presentation. Thank you.
Thank you, and thank you, Dr. Borrero. We're so glad you're here tonight. Turning it over to you.
Well, thank you. First of all, I want to say I want to celebrate for all of those who are Latinos like me. We are celebrating our Hispanic month. And in the middle of this pandemic, that is something that we should find joy in and celebrate our heritage and our culture. So, felicidades a todos los hispanos. So I believe we are taking a vote. Is this question finished?
Yes, you can keep going. Yep.
Okay. So next slide, please. So I wanted to start with the middle of this pandemic has really given us a lot of stress, and we continue to think about what can I control. So I wanted to first start thinking about influence and control. And take a look at this slide, and it really gives us an idea of the stress that we're all facing, because I'm in this with you, right? I do have 2 children. My son does have a disability, but he's a little bit older now. He's 24. And I'm not in the school system as you are with children in the schools anymore, but I worry. I'm in the schools as an administrator, and I worry, just like you, about my students, about the children that I work with and I work for. And I want you to look at this slide, and I want you to think for a moment, what can I control? And look at the yellow dot in the middle. What is it that I can really control? What can I influence, which is the lighter blue circle? And what is everything else outside of my control and my influence? And think of it as I can control myself, my body, my space. I can influence my family, my household, and everything else outside of my family, right? That I might be able to influence, but I can't really control. I can't control my neighborhood. I can't control what happens outside my immediate space. Because we worry sometimes too much about everything that's happening around us. And we just can't do that, right? We worry too much. For example, today at work, we've all been getting ready to start school, and a lot of the teachers are worried about, will I have a space to work? Will I have a space to work with my children? Will I have even a space where I'm going to park? Things that, can we really control that? Can we really know until we get to school on Monday? So why worry about it today if I can't control it today? So sometimes we have to step back and think, what is it that I can control? So I want you to take this image with you as we go along the slides tonight and think about, again, what is it in your immediate environment with your children, with your family, where you live, that you can actually control? Next slide, please. So let's set you up for success, because this is where I think all of us can really control. This is where everything that is happening, besides the pandemic, you have the control. So it's setting yourself up and your family and your child for success. So do you have everything that you need? Do you have the technology? Do you have the materials? Do you have the supplies? So in my house, I'm right now in my dining room. I have set up an office. So I have half of the dining room table. I have it set up for everything I need. I have 2 computers. I have the pencils, the papers, the notebooks, everything I need. But I also have another office upstairs, because when I get tired, I need another chair, I need a change in the environment, I go upstairs. So I have 2 spaces. I'm always constantly changing, because sometimes it's just I need a space change. Same thing with your child. And you know your child better than I do, right? So sometimes I just need a change. I changed the space, used to have the table different. I used to face that window. Sometimes I face this window. So the space where I work is important, right? Sometimes I'm too close to the kitchen. Well, then I go upstairs, right? So what is the space that you need? What's the space your child needs to work at? Do I have all the materials that I need? I have 2 computers. I have 2 phones. Everything I need is here. What does your child need? Sometimes it's really good for you to take a look at what your child's classroom looked like. You could ask the teacher, and that's the second point here. Set up a consult time with your child's teacher and ask her or him, what does his classroom or her classroom look like? And sometimes teachers have a corner. Well, they have a breakout corner, or they have a specific area where your child used to take a break. What did that look like? Can you set a space like that for your child at home? Take a picture of it. Have the teacher send you a picture. Can you replicate something like that for your child? Ask for learning or show times from your teacher. Use FaceTime with the teacher. So these are all places that you can set up in your home that are easy to do, even if it's just a virtual time. Ask the teacher for reading in TED Talks or even chat rooms to do virtually, so you can set up the spaces similar to the classroom setting. And these are really good to do in other languages if your child is just learning English. Also do it where you can connect with other parents. One thing that we have done a lot of in Boston is to have a coffee hour just like we're doing tonight, where we gather with parents and we do it in different languages, and we just open it up for questions. Half an hour, 45 minutes, and sometimes it's just anything, any topic where what are you worried about? Or what did you do to address homework time? Or for high schoolers, we had a little trouble getting high schoolers out of bed to come to class early in the morning, right? So teachers were starting to record the lessons so students then could see or take classes after 1 o'clock in the afternoon, because that's kind of the time they were getting up, right? So teachers were setting up their Google Classrooms and had the classes set up so kids could go in and see the classes after 1 o'clock. Some kids were wanting to see classes after 6 o'clock in the afternoon. That was okay because they were recorded. Now, the teachers set it up that they had to do check-in, right? They had to do like an exit ticket to make sure that they saw the class. And that was fine, as long as there was an attendance sheet. They took the class. It didn't matter if it was at 6 o'clock or at 2 in the afternoon, they attended the class. So working with the teacher so they could really then, they could sleep until 10 in the morning or 1 in the afternoon, they attended the lesson for the day. So working with the teacher where the student then was taking the class at their time, at their convenience, was really very helpful. Also, do you know when to call, you need some help? Have you reached out to the teacher? Do you have their emails? Do you have their phone numbers? Just a simple, upstairs in my other office, the wall behind me is full of sticky notes, all the phone numbers that I need, all the messages that are important with either passwords or people that I need to reach quickly. Instead of having it on my phone, I have them on my wall. So little ways for me to remember, right? Same thing with your child. What are the steps that they need to know or things they need to do on a daily basis? You could use sticky notes. You could use a whiteboard. You could use a bulletin board to help your child with routines. And we'll talk about routines a little bit further along. So these are just strategies for success. Do you have what you need to set yourself up for success? Any questions? I see some things in the chat. Just let me know if there are some questions. Next slide. Thank you. So let's say you don't have all the things that you need. What happens when you don't have, let's say, technology? This pandemic hit us really hard, hit us really fast, and we weren't ready, right? Not everybody had a computer at home. Not everybody had internet access. So we were lucky enough that we live in a state where a lot of these companies were very generous and offered good rates or even free internet connections, right? And many of our families were able to get discounts or free access for a few months, right? So how do I go about that? So let's have a plan B. Ask for paper copies. We still can do all of our work on paper copies. So connect with your teacher, ask her for paper copies, get books. Just make sure that you set up a time to go get these at the school. Ask for a phone number from the teacher and ask the teacher to get you, excuse me, when you can reach her, to have a conversation, maybe set up every other week to consult with her. Another person in the classroom that you can reach would be her paraprofessional, if there is one. If your child is a child with autism, there might be an ABA therapist in the classroom that you can connect with if the teacher's not available. And that person can help you with some of the routines in the classroom and some of the technology that your student uses. Does your student use a communication board? Well, then you connect with the speech and language therapist. Does your student have supplies in the classroom that they use? For example, books or fidgets. You can ask the teacher to borrow those and bring them home and set them also in their space to have them available. Ask for access to other technology. Many of the schools have computers that you can borrow. Some of the districts have these available, or even in the library, public libraries. I know here in Boston, many of our public libraries have programs that you can borrow computers if you don't have one, or your district didn't offer computers for all of the children. So technologically speaking, you don't necessarily need to have the highest level of a computer. You can borrow one. You can have materials available at home to follow the project with your school. If you do not have a computer, you can then go back to the school and find a way for the school and you to work together. Consults with teachers and your students' IEP team is very important, right? So you can schedule a regular time. But what if the other providers aren't available? You know it is your right to request a team meeting at any time. Maybe not all of the specialists are available, but you can meet with the speech or the psychologist or the therapist. But you can request a team meeting. You can request a consult, even if it's just a check-in for 5 or 10 minutes, so you can set up the times, right? Even if they can't speak to you on the phone, you can request a little video. They can send you a video. What does it look like for your child to do an activity on the computer? And they can be sending messages between your student and the therapist, or your student and the speech pathologist. That's another good way for them to communicate if they can't have these regular consults. And those seem to be a lot of fun, because then the student can record the lesson back to the therapist. And just like we're doing tonight, you record the session and then just send it to the therapist online. There are many other ways. For example, as a psychologist, we do a lot of counseling using a lot of short videos that are found on YouTube, or even short TED Talks that you watch and then you record your answer, or you watch in a group and then the group records it back to the therapist or to the psychologist. So there are many ways of getting the services through this virtual world and the communication with the other group members. Excuse me. How about parent groups? I know this is a hard time, and I think when we work together with other parents, it makes it a little easier when we support each other. Do you know other parents in your child's classroom that you can connect with? Maybe then you could do some Zoom play dates when you can set up some Zoom meetings. Or even, it doesn't have to be Zoom, it could be Google Chats that you can figure out. That's a good autism connection, where you can then have these play dates online, right? And then while the children are interacting, the parents are also interacting and sharing resources and sharing times where they can figure out, oh, I found this app, or I found this material, or I'm doing this, and this is working for me at home. That way, not only is your child getting to be connecting with others, but you are also connecting with other people. I also find that the SPED packs and the English Learner packs are another great way to stay connected and also get the information that is out there. We are moving at such a fast pace, and we're getting so many new information and connections that it's important to stay informed. So both of these are great ways of connecting with other families across the state. Next slide, please.
So we do have a question if we can pause quickly here.
And we're doing a polling question too about what your child's experiences have been while we do the question.
I just want to remind everyone too that we're sharing resources in the chat box, but questions can be submitted in the Q&A box using the Q&A button on your menu, or on Facebook if you want to comment a question, we will answer those as well. So our question is, what do you think parents should do if they haven't been able to connect with a teacher or any team member, or if they can't schedule a regular time? What steps can they take?
I would say reach out to other team members, right, of your child's IEP team, like speech therapist, ABA therapist if it's a child with autism, psychologist, social worker. Social workers are usually very easy to connect to because they're not as busy as the other team members, right? They're out there, they're connecting with families. They're really easy to connect to because they're all over the school, right? They're always getting to set up meetings, and they're really good about setting activities for parents. So it's easy to find them in the buildings. I know we're still virtual, but you send them an email and they're really good about responding. So I would go there first if you can't find the teacher, and they're good about making those connections and helping connect parents. So I would try that. And then always request an official IEP team meeting, because that's by law, they have to respond to that.
I think those are great suggestions. And then in addition, I think it's been frustrating for parents these past weeks because teachers were back with those 10 days when they weren't actually interacting with children or parents. And so teachers and all team members should be much more available now. But I know that it still has been hard for some families to connect. And so, I mean, the state has made it very clear in their legal guidance that somebody from your team should be connecting with you in the very near future to discuss what your child's experiences have been these last months and to talk about how their IEP might be implemented differently. And I don't know if Dr. Borrero, if you would agree, but if you're not getting a response back from the team members who are all going to be really very busy right now, then it's totally appropriate to contact the principal, if you're the special ed administrator. I think most people will hear back because the teachers and therapists are so concerned and eager to see your kids. But it is also really fine to advocate if you're not getting a response back that you need in a timely way.
Yes, and I do want to also say that it's concerning for us as staff members, right? And this goes across for the whole state. We have to come back to buildings that not necessarily are completely safe, right? So we are worried about children coming back to buildings, but we are also worried coming back to buildings.
Of course.
So we're thinking about ourselves, and we want to be healthy to receive children, and we want to make sure that we're all healthy. So these are times that are extremely difficult for everybody involved. So everybody's trying to make the best decision possible. I unfortunately was not able to hear the mayor's noon press conference, so I'm not really sure what he said today, but I know that everybody's trying from the governor to the mayor, everybody's trying to really find the best way to keep everybody healthy and making it the best, the classrooms clean and with social distancing. So yes, it's going to happen. I know we're all worried, and we want to see the kids. I mean, we want to be there and be working with the kids. But it's going to take time, and it's nerve-wracking right now, but it's happening. It's slowly developing, right? We're getting there. We're getting there.
Joanne, do you mind showing the results of that poll again so families and Dr. Borrero can see it, the one you just showed?
Joanne, you're muted.
I don't remember exactly the numbers, but I think over
Sorry,
70% of the families tonight, Dr. Borrero, said that their children are experiencing anxiety, and and it was too fast for me to see, but over half said that their children were experiencing depression and increased behavioral issues and other social emotional issues as well. There we go. Hey,
Anxiety.
not a bad memory. Look at that.
Yep.
Yeah, almost 80% of, I mean, these are pretty dramatic numbers, don't you think, Dr. Borrero?
Oh, yes. And I would, this does not surprise me. Of course, I think the nation is experiencing this anxiety. We all are, right? When we go outside, when we go shopping, when we go even walking in our neighborhood, we are all very anxious. So this is where we as parents and as adults have to really think. Again, we go back to our first slide. What is my reaction to the situation, right? What can I control? We have to start thinking, I have to set the example. I cannot be that nervous. I have to do what I can, right? Wash my hands, put on my mask, and start saying, it's going to be okay, right? We're going to go back to school, and this is what school is going to look like, right? We're going to have less stuff in the classrooms. The desks are going to be separated. We're going to be cleaning our hands more. Everybody's going to be wearing a mask. So making this our new normal, right? So kids are starting to then decrease their anxiety because what they're going to find is going to be our new normal, right? So again, I'm going to just remove the thing here because I couldn't see, but let's look at what happens when we start going back to school, because here the virtual model is, if we stay home, it's all about routines at home. This is what we've been doing for the last 6 months, right? What does it look like at home? Well, home is a safe ground, but now that we're going, and maybe we could go to the next slide, which is the hybrid. If we go back to school, then we're talking about the bus. Then I'm talking about going into the building, seeing my friends, seeing the teacher, right? So we need to start speaking to our children. What do you think will happen, right? Let's start having these conversations. And as we know, not all the students are ready to have these conversations. So we need to start breaking it up. Let's start talking in small portions, right? So we can start talking about, they started to clean the schools, right? They started to make the classrooms safer, right? So we break it up in small patterns. When the bus picks you up, we can only use one seat, or only 2 people can share a seat, right? So we go over the guidelines so they know what to expect. This is where the hybrid model comes. We're only going to go to school 2 days a week, or we're only going to go to school Mondays and Thursdays, right? So we have to start the dress rehearsal, telling our kids what we are going to expect. And we should be getting those, depending on your district, what's going to happen. The bus will pick you up. I'm going to take you to school. The first week I'm going to be with you. We'll walk in the school together, or I cannot walk into the school with you. I'll drop you off, right? So it's this slowly every day we'll walk through the dress rehearsal, going through step by step. You know, I'm going to drop you off and Miss Jones will greet you at the door, right? And when you get into the classroom, there's going to be hand sanitizer. When you go to the bathroom, there will be hand sanitizer. So it's this routine so the student knows what is expected, what is going to be the new normal, and that it's okay. What happens if you don't have your mask? What happens if you lose your mask, right? So giving all of those scenarios, but every day just doing it a little bit at a time. So that way the anxiety is not there, and adding a little bit more and playing the new scenarios out, right? So for example, I have here the dress code. Yes, everybody should wear a mask. What happens if your friend forgets his mask? He can go to the nurse's office and ask for one. There will be some extra masks in the nurse's office. Maybe I can put an extra mask in your bag in case you forget your mask, right? So running through these scenarios will reduce the anxiety for your child, right? What if you lose both of your masks? What do you think you can do? You can go to the office and you can call me. You can go to the nurse, right? So always think about playing through the scenario so we reduce the anxiety, because that's the unknown about this situation is what always gets us into trouble when we can't figure it out, especially our children who have multiple disabilities or have disabilities that changing the scenario quickly just doesn't let them move on. Those are the kids that we really have to protect, right? So these kind of kids need a social story that they can look at, that they can review, that they can carry in their book bag, right? These are the kids that benefit from having a little piece of paper that says, if this happens, this is what I can do. And they can stick it in their pocket, right? Call mom. These are the numbers. If I can't find my mask, I can 1, 2, 3. I can ask the nurse. I can look in my backpack. I can look in my lunchbox, right? These are little things that will reduce the anxiety, and your child can then continue with his day. Creating opportunities for interaction. You can ask your friend. Remember, we talked about when we were at the play date with Johnny, these are some of the things we learned with Johnny. And giving your child always the advantage that he has options or she has options. These are some of the things you can do. We cannot be sharing food, right? So if you don't have food and Johnny does, or you have food and Johnny doesn't, and you know he's hungry, what can we do? Ask your teacher for permission, and maybe she has a wipe and you can clean off the potato chip bag, right? And then you can give them the chips, right? Because that's what kids do. When your friend is hungry, you give them your chips. But we've got to then help them. No, we just can't give them the chips. We've got to clean them off, right? So we're following the guidelines, and then you share your chips. Or you can just open the chips and pour them on a nice clean napkin, right? So just always giving the kids the ability to do the right thing, but always with the protection. Hope that is clear. Next slide.
We have a couple more questions that have come in, if we can take another break here. Our first question is, our district is bringing back vulnerable populations into the buildings, but they're participating in virtual instruction while in the building and receiving all services remotely versus actual in-person instruction. How can we improve social skills? My child is too old for me to arrange play dates and has increased anxiety around making plans directly.
So I would start with doing some examples virtually. So looking at short videos, right? And having him watch or her watch those videos and then interact. Yes, he might be too old for play dates, but then having other kids watch the videos with him. You know, like Zoom is really good because you can break into breakout rooms, right? And have other kids in those breakout rooms and then kind of go into the breakout rooms and discuss it. And then maybe make some face-to-face connections outside before it gets too cold. That's the downside of living in New England. But slowly then integrating him or her outside, right? Let's do it first in Zoom, breakout rooms, and then let's do it outside. I'm hoping that places like the Boston Museum, Children's Museum, those kind of places would allow more people to start coming to visit, so then our population could then start benefiting from going to these places. We need to start connecting and having our kids connect more and more. Because, you know, keeping them in the house or keeping them in the school without those connections, that makes it a little bit harder. I hope that helps.
Yeah, we have sort of a follow-up to that. I'm choosing.
Can I just ask one question, Dr. Borrero? Do you think it would also help in that situation for the parent to reach out to whichever team member they feel like has a good connection with their child and ask for them to brainstorm with the parent how to address this? I mean, clearly social communication is really hard in this environment. But I'm wondering if the team member who knows the child might be able to, together with the parent, figure out some solutions.
Yes, definitely, definitely. And, you know, the other good thing is that these team members could probably also help arrange some outdoor activities, right? So that might be a great way to get them out. Some of these kids might not want to go back to the building, right? And this might be a good way to bring them back. Yes, that's a good idea. Here's another question.
Yeah, so I'm choosing between increased screen time for my 13-year-old so that he can have some social connections versus pre-COVID concerns about screen time and gaming usage. Do you have any thoughts on this in terms of the utility for social emotional connection?
Great question.
Yeah, that is a great question. Yeah, because it's that balance, right? You want them to connect, and then it's how or what is the material they're connecting with, right? So it's that balance, especially with boys, because boys would want to connect more with the games, and it's the appropriateness of the games. So I would balance it out where they would create a game, right, so to connect with friends, and then share that game with other friends. So yes, you can play. The kids that I used to counsel, they used to have a Minecraft game. So yes, you can play Minecraft, but you have to teach others, right? So they would have to make a connection. You have to create a lesson, and then I would videotape the lesson. So then they would have to put it on the computer, so that way they were teaching other kids. You can play the game, but you were teaching other kids, right? Now I can see that we should have done that many, many times, because now this would have been very useful during this time, right? So that's a good way of doing it. Yes, you can use it for playing your video game, but that video game is to interact with others. Make it have a purpose to interact with others, right? So make that double connection. And then of course, slowly then you will decrease the amount of video time and increase the interaction, right? So you as the parent will then manage the amount of time they're playing the video game. So play for 10 minutes, but your video to share would be for 15. And that way you're controlling the amount of time. Are we done with the poll question? Yes?
Do we have the results of the poll, Joanne?
About half and half. I think that because schools are just getting up and going, this is kind of half and half. I would say if maybe by the end of September, you haven't been able to speak to someone, then that's when I would then make a more aggressive effort to really get in touch with someone. Yeah. Quickly over this particular slide, this is two ways of looking at education. So you have on the right-hand side, Maslow hierarchy of needs. So if we don't have this particular way of thinking about our needs, we can't learn, right? So Maslow goes from the bottom up, right? The basic needs, food, water, safety. And then Bloom's taxonomy of learning is also from the bottom up. If you don't remember, you can't understand, you can't apply, all the way up to creation, right? So teachers work between these two worlds. The same thing applies to parents, right? If we can't really meet the needs of our children in food, water, we can't build going up, right? Same thing with learning. We can't really focus and help our children remember and understand that we can't really balance these two. Now, as parents, we're not teachers, we're not educators, but we are, in the sense that we are building this environment in our home where they feel safe, where they learn to understand, where they build relationships with us and our other family members. So we are teachers, we just don't get paid for being teachers, right? So we're really building this environment. And now that we've been brought in to being teachers, we have to take into consideration these steps. So when they go back to the building, whether virtual or not, this is the focus that teachers build their curriculum. This is the focus that teachers constantly apply math and science and reading. We have to also think, if the kids come to our classroom without the basics being met, they cannot learn. So if they come hungry, if they come anxious, if they come without having slept well, right, or slept at all, they cannot remember, analyze, apply, and do everything else. So we have to also learn as teachers to balance those things. And then what happens is that they become behavioral issues, right? Kids who misbehave, or kids who react in behavioral manner, we have to first start to think, wait, did he sleep well? Did he have breakfast, right? These are the questions that teachers have to ask. Next slide, please. And as Julia was saying when we started, this COVID has impacted our families of color more than anyone else. And here are some of the stressors that have really hit home. You know, during closure, it has hit our families of color more than anything else, because most of our families of color either have lost a job or have lost a family member. And that just hits, again, going back to Maslow, has hit us really hard just at that foundation, right? And what happens when the stress hits our body and our brain? It hits us in two areas: the internal, which is that anxiety, that depression, grief, anger, and isolation, or externally, which is that aggression or the behavior problems, right? And we see the aggression and behavior problems, and you see that on TV all the time. People who get extremely angry, you know, they fight because they can't get into the store because somebody has asked them to put on a mask, right? We see that all the time. That's the anger coming out. We can address that by going back to those routines we've been talking about. Keeping your child in these routines, keeping things moving, keeping your life as predictable as possible, right? Trying to keep the day moving, keeping it, if you had breakfast at 8, keeping breakfast at 8. If you had a break at 10 and you went outside and played, or you watched a story, or you listened to music. Routines for children work. They want to know that things keep being the same. Routine is the key to success, right? When we break that routine for children, they don't know what's happening. The social stories are critical for kids with autism, because that makes them nervous that they don't know what's coming next, right? So trying to keep your routines in your home, in your everyday life, is the key to managing this anxiety provoked by this pandemic. Next slide, please. This slide is really more about a teacher's point of view. So I have left some links here for some checklists and things that teachers use, just for you as parents to take a look at. I'm not going to go into a lot of details, but I want you to think about what teachers look at when they're looking at children, right? So they have checklists for building relationships with kids. They have a check-in for when the kids are coming back. Community guidelines, building community circles. So I wanted you to take a look at what teachers are going through, right? We're worried that things are not happening, or people from school are not connecting with me. This might give you an idea what they're going through right now, right? It's not that they don't want to connect with you, it's that they're busy trying to create this environment for your kids to come back to school and have everything ready that they need. So I wanted to give you that lens. And you can click on all of those and the links are there. The next slide, please. So quickly, I wanted to give you an opportunity to think. You will have all of these slides. What do I need to put in each of one of these toolboxes? What are some of my home routines that really work for me and really help me at home with my home routines? You know, my child goes to bed at the same time. During this pandemic, I have been able to keep my home routine. My kid goes to bed at 8 o'clock. That has been very successful. Or no, I need to work on the bedtime routine. That's something I need to really work on. So in my home routine toolbox, that's something I need to add. Workstation. I really don't have a workstation. And my child doesn't really have an area where he needs to work. It doesn't have to be a fancy workstation, or maybe I need to set one up. So I need to drop that idea into my workstation, right? Or I do really have a great workstation, or I need more tools there for my child to be successful, right? So I want you to think, what do you need to add, or what do you need to take out to make your workstation or home routines better? Next slide.
We've had some questions come in, if we can take another break.
Yes.
Okay. Our child is high need and the school is not mixing fully remote with children doing hybrid. Our child that is fully remote cannot join band as he did before. He has no gen ed accessible to him and he's only in class with other children on IEPs. Do you have advice?
What instrument did he play in band?
Is this person still here? I don't know if they're still here.
Because that would be great if he could have his instrument at home. Is there any way to set up a private lesson with the band lead teacher? I mean, unless it's a tuba or something like that, right? But that would be a great way to connect him with school, right? To bring that instrument, borrow that instrument and bring it home, and then have the lesson be continued virtually. That connection could be established. And if it's a big instrument that he can't bring home, maybe change his instrument.
Drum set. He has a drum set at home.
Neighbors might not want that, right? But, maybe some other drum-related instrument, right? Congas or something, you know, working with his teacher to bring another instrument, because the child needs band, the child needs his music, right? And so adjusting the musical instruments so the child continues to feel part of band would be important to discuss with the band teacher. Right?
If the band teacher is not willing to work with the child, are there other steps that they can take? Sounds like that might be happening.
Yes, I mean, there's always the private sector asking for, you know, I don't know what the community might have. Is there some volunteer work, some community service, even high school students that might be willing? I know that at least here in Boston, the, oh, what's the name of that university?
Berkeley?
I'm sorry?
Berkeley School of Music?
Berkeley, reaching out to them. Sometimes those students have to provide some like internship hours, reaching to some of those so that they could do, you know, virtually. That might be an option, that they could do some band work and have the school let them borrow the instrument. So doing a little bit of research to see if there's anything like that that could be done online. And there's always Khan Academy. They do a lot of online services. So doing some research online, I'm sure there's got to be a way that they can get some activity online.
I think the other part of that question was something that a lot of students with disabilities are experiencing, is that their IEPs offer them to have time participating at least part of the day with non-disabled peers, which is so important to their social and academic growth. And because of the safe and health requirements, there's a big concern that that won't be able to happen to the same degree. So Dr. Borrero, you know, at least it's my understanding, not being in the system like you are, that IEP teams are really thinking hard and want to get parents' ideas about how to provide those important experiences. So, and there are, you know, that's also the kind of thing where if you can't work something out informally, to call our helpline, and we may have some other ideas as well. But there's hopefully will be creative ways to have a participatory band experience, even if it is through Zoom. There's been so many amazing things that have been done with the arts together, even if people can't be in person. And I think most people, teachers and therapists and IEP teams really want to partner with you to figure out how to do these things differently. But it's going to take your ideas and their ideas together. It's nobody's done this, so they can't do it without that partnership. I don't know, does that make sense to you, Dr. Borrero?
Yes, yes. And I think a simple ask, right? Just simply calling Berkeley and saying, hey, we've got this idea. Is there any way that you might have some students that are willing to to play along, right? And in this virtual world, would they be willing to do a couple of hours of free lessons, right? To help our students. I think just asking, what could they say? No, right? And I don't think they would. I really don't. I think these college students are looking for places to practice. So yes, I think that's a great idea. Reaching out, maybe using MAC to be like a place to have these discussions would be a great idea.
And you could see from the poll results of that last question, Joanne, sorry, I know it's hard, you can't talk and look at the results at the same time, but because we're at the beginning of the school year, it's got to be harder for families and teachers, because if you don't have a clear understanding of your schedule yet, and you don't have these times to talk yet with teachers, then everything is going to be more difficult. It is definitely expected that all this is going to happen in the next several days and weeks. So as Dr. Borrero said, if you cannot get those connections and answers to your questions, health and safety and other questions, then that is an appropriate time to call the helpline.
Yeah.
And a lot of families need to know who to contact if your child's unable to participate in the remote instruction for students with more significant disabilities, the way Dr. Borrero was talking about. And as she was saying, it's completely appropriate to ask to have somebody to contact if your child is not able to interact and participate in what's being offered.
Mm-hmm. And again, we live in a state, and at least here in the city of Boston, that has so much to offer our kids, right? The summer is we've missed out on a lot of summer opportunities. The city had so much to offer, and because of this pandemic, we've lost a lot of services, right? I live in South Boston, and I know that Castle Island was always filled with kids, either sailing or summer camp or swimming and doing so much. We haven't had any of that because of this. So kids have really lost out, right? And many of these kids were kids with disabilities, but were all with other, all mixed. I knew who they were, right? Because many of them were Boston kids, but they were all having a great time. And we've missed that. We've really missed these opportunities. So reaching out to your communities, reaching out to these universities. We've had a lot of students that were kind of stranded, college students that have been stranded here because the school has shut down. Reaching out and asking, is anybody out there interested in supporting our students? And we'll see what happens. I think this is a great opportunity for the community to really support us. So let's see what happens. Next slide. I know we're running out. And then this is about you parents, the well-being plan for you parents. This is not easy. It's been a hard 6 months. You are the heroes. These are your kids. I always said this when I was working with my child and his IEP and going to IEP meetings, I would walk in and I would say, I am my child's biggest advocate. Yes, I'm a psychologist on the side, but I am his advocate, and I am here to get him what he needs to be successful in life. So yes, I am here to really get him and push him along, because he can succeed. It doesn't matter what his disability is, he can succeed, and your child will succeed because he's got you. But if you don't take care of yourself, and if you don't really take time to really take a minute and say, I need to sleep a little bit longer today, your child loses on his best advocate. So think about, what do you need to take care of yourself and take a minute to prioritize your well-being, because this has been hard for all of us, right? Who takes care of you, mom? Who takes care of you, dad? It is exhausting sometimes, and just even a moment to just breathe, even if you just sit outside for a second and watch. I think tonight is a full moon. Just take a minute, right? Just take a minute and then say, you know what, we'll do it again tomorrow. Tomorrow's a new day. We'll go back at it. It'll all be over. And when we look back at 2020, we're going to say, oh my gosh, it's all going to be over, right? And at the end of the day, we did this because our kids are wonderful and they deserve great parents. The last slide is some mental health connections and some phone numbers. I know it looks like a lot, but I just wanted to make sure you had numbers and places to call if you were concerned about your child's mental health. This is a time to take it seriously, to really, if you have any concerns, these are places where you can go and get some support. Always your child's pediatrician or your primary care physician is the first place to go. They have great connections, and then these are other numbers. But I also have in the last slide my personal email and my personal cell. I am available if you need just a referral, or if you want some ideas, I'm more than happy to connect with you. An email is easier to get me. The phone is very hard. I can never answer my phone. So a text or an email is easier to get me. I really appreciate your invitation for tonight. I'm a parent, like I said, and my child's biggest advocate. So I encourage you all to hang in there. We are all in this together, and it'll be over soon. You'll see. Hang in there. So I will be around a little bit longer for questions. I know it's 9 o'clock and some of you might want to go, but I thank you for this opportunity.
Dr. Borrero, thank you so much. I mean, the students in Boston are clearly very fortunate to have you there working day and night to address their needs before COVID, and clearly even more intensely now. And we can't thank you enough for sharing these ideas and some really practical tips of what folks can do. I think probably we have time for one more question, Lilia. If you don't mind going a little bit over 9.
No.
Yeah, and then next 2 weeks will be our next chat, and Dr. McDade will be here to talk about strategies for how to increase, how to address the needs of students with disabilities who have difficulty connecting remotely, and how to help them to really engage more effectively through remote learning. So thank you, Dr. Borrero, and we look forward to your last question of many.
Yes, and if we weren't able to get to your question today, please do contact our helpline. That information's in the chat. Our last question is, my school system decided at the 11th hour not to open the school on Wednesdays and to be remote. So to be clear, the children are in school Monday, Tuesday, Thursday, Friday, and remote on Wednesdays. I have a 6-year-old who has an intellectual disability, is nonverbal, and autistic. And I have a 4-year-old who has some delays, and watching the teacher on Zoom left him traumatized each time, and we had to stop. He can go on a Zoom with others, but not school staff. It was too upsetting. What are my requirements to engage in half-day remote on a Wednesday?
That's going to depend on your district, right? But maybe what you can do is you can videotape what's happening on Wednesdays, and then at another time when the child, between you and your child, you can get that information instead of having the child view it. You can just take the information and then you can present it to your child, right? Because if visually it's too much, just take the information out and then you present it at a different time, right? I know that sometimes for me, visually, it's just too much because trust me, I spend a lot of time on Zoom. So, you know, if it's just too much, you can listen to it, and whatever it is that they want the child to do, then you could do it at another time. Turn off the camera. As long as the material, you can do it at your pace, at your whatever's comfortable for your child. I hope that helps.
And Dr. Borrero, would this be another example of where the parent could reach out to somebody on the team to explain this barrier in terms of them accessing it and figuring out another way to modify or accommodate this in an ongoing way so that it's less stressful and they can still access the information?
Right.
Again, nobody can know how to not one size is not going to fit all.
Exactly.
But it seems if you don't have the conversation back and forth, then the team won't be able to help you to figure out how to make it more accessible for your child. Do you have anything that makes sense to you?
Yeah, and it could be a case where send it to me paper form, right? If it's I have to do some work, right? Then just send it to me paper form. And if it's a story I have to read and she has to answer some questions, or send it to me paper form. It doesn't have to be a video.
That's great. Oh, I wish we had more time. Thank you so much. I know what time this woman goes to bed and what time she wakes up, so we're going to let you go. But thank you so much, and we will see you all in 2 weeks. And again, thank you to Dr. Borrero for all you're doing by being with us tonight and for all the kids in the city of Boston.
Thank you. Have a good night, everyone.
Take care.
Thank you, everyone. See you in 2 weeks.
Thank you. Good night.
Bye.